Yes, good morning, everyone. For all those who are logging in from India, a very good morning. For others who've logged in from other parts of the world, good afternoon, good evening. Welcome to Geopiracy's Sunday special. The COVID-19 pandemic has had far-reaching effects on all walks of life, and it is showing no signs of retreat. The confusion of what the future holds and the utter hopelessness of not being able to plan our lives makes the present tough to handle. At such times, it is imperative to have the right perspective and deal with the current situation as best as we can. To give us tips on how to do that, we have with us today a leading psychiatrist, Dr. Kersi Chavda. Dr. Kersi Chavda actually needs no introduction, but I'll still read out a few of his achievements, which are really very long. We have with, he is the past president of the Bombay Psychiatric Society, consultant at the PD Hinduja National, Hinduja Healthcare, and Sir H.N. Reliance Foundation Hospitals. Dr. Chavda has been working in the mental health field since the last 35 years. He had been chairperson of the task force of Indian Psychiatric Society, IPS, dealing with school psychiatry and counseling. Currently, he is advisor for the IPS task force dealing with school psychiatry. Dr. Chavda's field of interest is children. He had been part of the first panel of Maharashtra government that laid down concessions for students with learning disabilities. Above all this, Dr. Kersi is an amazing, happy, positive doctor. Without wasting much time, please help me welcome our speaker for today, Dr. Kersi Chavda. He will share his vast knowledge and experience on how to cope with the current situation as best as we can. Dear viewers, please post your questions in the chat box. At the end of this session, we will answer your questions. Over to you, Dr. Chavda. Yes, yes. Shamla, please unmute Dr. Kersi. Just a minute, huh? There's a technical glitch. Shamla, unmute Dr. Kersi.
Yes, 1 minute. He is unmuted. I don't know why he...
There we are.
Yes, sorry. Yeah.
No problem. I know you don't like me, but it's okay.
No.
Okay, ladies and gentlemen, it's always a pleasure to talk to people, and it's even a greater pleasure when they're lovely people from your own community. We are passing through a horrible stage of affairs. It frightens us. If we as mental health professionals, if we as doctors can get so frightened and so upset at what is happening, it's certainly not surprising that we see so much of negativity, so much of anxiety, so much of bad stuff happening around us. I'm not going to be talking of the physical aspects because you have other experts for that. I'm going to be talking about what we actually see mentally happening, because I do see so much of negativity, so much of stuff happening, so much of anxiety, so much of depression, that it kind of breaks your heart. I've been telling people that, we learn how to be clinically detached. We learn how not to take worries home, because otherwise we'd collapse. But over the last 2-3 weeks, I find myself tearing up. I find myself choking when I'm dealing with relatives of people who have had the COVID, relatives of people who may not have had the COVID, but because the hospital has been converted into a COVID situation, regular heart attacks, regular strokes have not been dealt with just because of an overstretched health system. Let's start from the beginning. Now we know about a year ago when the pandemic started, everybody to some extent was a little happy. You were not going to go to work, so you would spend 1 hour more at home. People were going to, kids were not going to go to school or college, so they said, wow, we'll have a little more time to ourselves. Families felt that there would be more bonding, etc., etc. What actually happened Over a period of time, we discovered it wasn't all as hunky-dory as it seemed to be. We discovered that there was really no fun in being trapped in a house where maybe 1 or 2 kids were doing online studying, mom and dad were both working online. You had an elder in the family, and that elder in the family who was used to his or her own time suddenly had to be told not to make noise because everybody was getting disturbed. If the person was dependent, if the older person was dependent and you had people coming in, a maid or a caretaker coming in, and suddenly the maid or caretaker couldn't come in, not because she didn't want to or he didn't want to, but just because there was no transport or because the building wasn't allowing the person to come in, then the responsibilities of that person who had a problem actually landed up being with one of the members in the house. It's amusing, it's fun, it's joyous for a month. It becomes irritating and causes anguish and frustration over a period of time. What also adds to the issue is, if I tell you that this thing is going to last for about 3 months, 4 months, then I work myself towards that. And I keep telling myself, it'll get over. It's the uncertainty of not knowing when it's going to end. It's the uncertainty of not knowing that, is there going to be a second wave? Is there going to be a third wave? Is there going to be a fourth wave? Is this damn thing ever going to end? It's this uncertainty which causes us more anguish. It's this uncertainty which causes us more anxiety. It's this uncertainty that causes the enormous avalanche of mental health problems that we are now seeing in our country. When the pandemic started, I was part of 5 mental health helplines. I was part of starting them. There was one which we started, which was a man basically by psychiatrists, started off only in Bombay, then became Maharashtra, then became across India. There was another one which was started off by psychologists, but any helpline also needs psychiatrists because sometimes you need medication. A third I started for the LGBT group because they have their own problems specific to their community. I started something for a pharmacy because we sometimes forget that, you know, pharmacies also are in the hotline and they're doing things which cause them a lot of anguish also. And finally, the Bombay Psychiatry Society itself started helplines, just like most cities and the Indian psychiatric societies now have helplines across India. What came across at that time? A lot of anxiety, a lot of depression. We didn't really know whether telemedicine stuff would be allowed. So if I gave you a prescription on WhatsApp, would that be honored by the chemists? You couldn't travel. There were blocks in distribution. All of those things were happening. People were getting angry. People were getting frustrated. Then there was this whole thing of we're getting on top of the pandemic, and people became happy again. And now we have the second pandemic, and the second pandemic is much, much, much worse. It seems to be much worse. People talk about the fact that it seems to be spreading faster. It may not be as lethal as the first, but youngsters are also getting affected. So it becomes a major issue. Now, what are the things that we are really looking at in my hospitals and in my clinic? Probably the most important thing, of course, is anxiety. And I think it will be stupid for us not to talk of anxiety because we are all human beings. We're not pieces of wood. We're not pieces of stone. When I look around me and I see the stuff that's happening, and frankly, when I look at the visuals on television, which absolutely freak me out, it makes me very anxious. Now, you know, we get into this thing of, oh, I'm anxious. I didn't meet my girlfriend, and I'm anxious. I didn't do well in exams. That is not what we call clinical anxiety. When we are talking about clinical anxiety, when we are talking of medical anxiety or psychiatric anxiety, we are talking of a person who has a feeling of impending doom, very often feels that, you know, gets into palpitation, gets into trembling of the hands, is constantly brooding and obsessive about a certain thing. Sometimes it becomes so bad that he thinks he's having a heart attack, and that because he has a heart attack, he's rushed to the hospital, and then the doctors check him out and they say there's nothing happening with your heart, it's actually happening from the mind. Anxiety also affects every member in the family, not surprisingly, because when you have severe anxiety all over, then everybody starts getting affected, and then you don't allow another person to do what he's supposed to do because you say, to I kar se, to I thar se, please don't do this, be very careful. And over a period of time, that can become nagging in a sense, and that irritates everybody else. Anxiety is extremely common. What we are also seeing a lot of now is depression. Now, once again, depression is used very loosely. So it used to be, you know, oh, I'm so depressed, I didn't get my favorite pair of jeans. I'm so depressed, I can't go on a date today. I'm so depressed, I haven't met my friends in a while. That is, again, not what we would actually call depression. That may be a little bit of sadness or irritation. When we are talking of psychiatric illnesses, when we are talking of psychiatric depression, we're talking about a person whose normal social, functional, occupational, relationship life has got affected. He finds it difficult to cope. Very often there is a lack of motivation, there's a lack of doing anything, there's a lack of satisfaction in doing what he would normally do. All of that gets affected. And then, as the biggest frightening complication of depression, he starts thinking or talking or actually attempting to commit suicide. We have OCDs. Now, I actually believe that Babas are very OCD. I mean, we like things to be very clean. We like things to be just as they are, and it might be very nice, but it can also become a problem. When we talk of OCDs, we are talking about, a person who has a thought, an idea, or a feeling that causes a lot of anxiety. So, for example, my feeling might be my hands are dirty, and that causes so much of anxiety that I've got to do something about it. So I start hand washing. And when I start hand washing, I start feeling better. But I have to hand wash in a particular way. So that becomes a ritual. And I have to hand wash over and over and over again because I don't want to get anxious again. So that becomes a compulsive behavior. So an original obsessive thought causes anxiety, you get a behavior, and then that behavior becomes obsessive. That behavior becomes compulsive, and you follow it in a particular ritual. And that is what OCD is all about. When we started off with the pandemic, people who are hand washing a little bit were actually doing a good thing. I mean, there were all these visuals, keep hand washing, spend 30 seconds on hand washing. In fact, I had a very, very cute little thing which was sent to me by my friends in America. They had twin girls. And those twin girls said, this is the only way we'll remember 30 seconds. And they would sing, happy birthday to you. And they'd sing that twice and it became 30 seconds. So people were learning innovative ways of dealing with it. Unfortunately, that sometimes becomes a problem and you just spend 6 hours, 8 hours, 10 hours hand washing. You get absolutely paranoid about somebody coming into the house because you're scared that that person might have the COVID. You're absolutely paranoid that you yourself, if you're testing positive, you're frightened that you might give it to maybe the other people in the family, and especially if you have aged parents who you have not allowed to go out of the house, but you had to because somebody has to, and you come back with the COVID, you're frightened that you're going to transmit it. That causes more OCD symptoms, that causes more anxiety. It's not a good situation at home. Now, these three things may be a little tolerable. We also have people who are taking more of substance abuse. So people who normally enjoy their little Parsi peg land up having more than a little Parsi peg. They'll end up having a lot of Parsi pegs, which is not very good. If you're smoking, then you'll end up having more smokes. If you're having drugs, we'll end up having more drugs. And we're seeing a lot of this increase right now because it's almost as if you're saying, I can't cope with the present. Let me do something that at least enables me to kind of calm down, get into another zone, etc., etc. All of these are very temporary. All of these are not going to work. We must also remember that alcohol is pharmacologically actually a depressant. So if you feel that it's making you feel better, it's not. It's actually over a good period of time going to make you feel worse. I'm certainly not saying that you should not drink. I am certainly saying you should not smoke and take drugs. But alcohol, for what it's worth, once in a while is okay. But we're ending up finding people having too much of alcohol too often, and then that can become a major issue. Please also remember, very morbidly speaking, that if you land up having physical problems because of what you're doing, so if you land up drinking too much and you land up having a liver issue, it will be almost impossible for you to be allowed to do anything about it. Because right now, 95% of all healthcare workers are only dealing with COVID. The more frightening, the more disgusting, the more horrible thing that we are seeing, even in our community, which shouldn't be happening, is abuse. Because people are so frustrated, they're landing up being abusive. So they'll end up being aggressive, physically, verbally, emotionally, and it's usually towards the most vulnerable person in the house. So we see spousal abuse, We see parent being abusive to child. And the most disgusting thing, which we are seeing over and over again, my colleagues and I, is parental abuse, where a young adult starts hitting or being aggressive towards his father or mother just because he can't cope with what is happening, and there's so much of frustration and stuff like that. There have been times when they have called me and I've actually advised, call the cops. And however bad the cops might be over here, I think they're incredibly proactive. They've come in and they've stopped what has been happening. But it's a very sad indictment of our society and what is happening right now, that you take recourse to being aggressive towards the most vulnerable person in society. It breaks your heart to think that a boy or a girl can actually hit his or her parents, and sometimes even grandparents, just because they can't cope themselves with what is happening. We talk of special children. We talk of special adults as well. Our community does have a fair amount of them. It's probably maybe a very large percentage. They have a whole bunch of problems which are specific to them. So for example, if a kid normally had a routine in which he would see his therapist, or he'd see a speech educator, or he'd see a special educator, he'd see a speech pathologist, he'd see a psychologist, he's used to a particular routine, he's used to be taking in a particular way. So for example, there's something called autism spectrum disorder, where the person is used to a particular way of dealing. And I remember very early in the pandemic, I was called by two of my friends who had a kid who was autistic, and both were doctors. Now, you know, there was this lockdown, so you weren't allowed to travel unless it was an essential thing. This kid was very aggressive, and the only way he would stop being aggressive is if he would be taken out in the car in a particular way at a particular time of the day, spend about 20 minutes, come back, and then he'd be fine for the rest of the evening. But if he weren't allowed to be taken out in the evening and the night after that was absolute hell for the parents. These were doctor parents. They were absolutely they didn't know what to do. The kid was anyway on medication, but you can't just keep giving medication. I suggested that I'd give them a letter stating what was happening, and they could try with the cops. So they gave it. I gave the letter to the people. They went to the cops, and God bless that cop, the superintendent or whatever, the chief of the police station. He gave them an emergency sticker or whatever else they do, and that kid was allowed then to be taken off. Now, things like that we don't really think about. I would never have thought about it. I've been in the business 35 years. I deal a lot with kids like this. This would never have crossed my mind. You've got to realize that all of us, including doctors, including mental health professionals, including the physicians, we are almost as much at sea as you are. Of course, we have our own basic training and things like that, but we are also learning on the way. So this was something that was absolutely amazing. I come across a lot of kids who, for example, are hyperactive, what we call the hyperkinetic disorder. They are on medication. Sometimes medications are not available. Kid goes absolutely berserk. You have kids and adults who might be having depression, who might be having anxiety, who might have OCD. Fortunately, ours is an extremely educated community. Fortunately, ours is a community which doesn't really shy away from seeking appropriate help from professionals. We have a huge amount of Parsi psychologists. We have a fair amount of Parsi doctors. We have about 4 or 5 Parsi psychiatrists. So a lot of you are already on medication. A lot of you are already taking stuff. Very often, because of the pandemic, the homeostasis that you're at, the level that you're at of balance gets affected, and you'll end up feeling more depressed, more anxious, more suicidal, have more OCD, can't sleep, get very angry, blah, blah. Get back to the doctor. And most of you would do that with your doctors. Get back to the doctor, get an adjustment done, etc., etc. Please do realize something. You owe it to yourself to get yourself in control. You owe it to yourself to do things that are appropriate for yourself, because then not only would you be okay with yourself, but you'd also prevent problems from kind of generalizing to the other people in the family. I mean, I cannot imagine, if my mommy or my father or my wife or my son were unwell or not doing well, the whole family would get affected. We're not living in little silos. So to say, oh, nothing is going to happen to them, it's only happening to me, what difference does it make? It makes a lot of difference. So stop acting like an idiot and do what has to be done in order to get the help that you need. People are trying to do a lot of things online. The government, fortunately, has allowed telemedicine, teleconsults to happen online. There are a huge number of medicines which can be prescribed, and then you can send it either on a PDF or on a WhatsApp message. The chemists are supposed to honor them, etc., because we don't want old people to come to the hospital. I mean, we don't want more of a problem than what they already is. And sometimes, even if they could come to the hospital because of travel bottlenecks, they're not permitted to. They can't reach. I mean, if you normally spend 1 hour on a train traveling from Virar to Bandra, and then there is no train available for the regular user, he's not going to spend $1,000 to reach the doctor by coming by cab. So it's easier to have this telecommunication thing going and to have this telemedication thing going. Whatever it is, find a way to reach your doctor. It is absolutely imperative. Things like therapy, psychological therapy, very, very good. You can do it online. Things like online physiotherapy, online occupational therapy, people are doing it. I know a huge number of people who are doing their best to do a fantastic job, as best can be in the circumstances, but it's not the same. So obviously it's going to be problematic. We still have to cope. We still have to do the best that we can. Given all of this, let's look at it in terms of what can I do to make life a little better for me? I think the most important thing that we really have to do is look at it in terms of it's not only happening to me, it's happening to everybody. I mean, it's a horrible way of looking at it, but I know I'd feel worse if it was only happening to me or only happening to 100 people I knew, rather than about, what's the population of the world right now? The whole world has got affected. The other day, I was standing at the window of my house and looking up, and my wife said, I don't remember the last time I saw an aeroplane fly past. And that's really true. Airlines have been grounded, things that we take for granted. Oxygen. Who on earth ever thought that we'd actually be saying oxygen is so important? We just took it for granted. So a lot of things have been taken for granted, and hopefully now we'll have a little bit of gratitude for what we have and not take things for granted. What's more important? It's what I call the feeling of connectedness. Over and over again, we found out that people who are constantly in touch with others, they seem to react better, have a better way of communicating, seem a little less scared, a little less anxious. I know that, when the lockdown was first there, because we had our stickers, our doctor stickers, we were allowed to travel without any hindrance. The cops really didn't stop us. But I had a senior psychiatrist friend who would travel to his hospital. And he once told me that, Kersi, whenever I get stopped, what I do is in my house, in my car, I keep a whole bunch of bottles of water, bottles of lassi, little packets of biscuits, etc. And whenever I'm stopped, because the cops have to stop you, I give them a packet and I say, thank you for all the good work you're doing. And he says that connectedness makes all the difference. When I was doing my work, even with other organizations which deal with providing stuff to people who needed it, one of the things that we saw is that youngsters, 18, 19, 20, 21, 22, they did fantastic work. Sometimes they were foolhardy, so we had to actually tell them to be a little careful. But on the whole, they did absolutely incredibly fantastic work. Very often, if a person was staying alone, if an old person was staying alone in a flat, now a lot of Babas stay alone. Maybe their kids are abroad. Maybe they're not abroad. Maybe they're in a different city in India. Maybe they are staying in a separate flat and not very far away. And there's normally a constant movement to and fro so that you don't feel absolutely bereft. But because of this lockdown, it doesn't happen. And because it doesn't happen, you feel absolutely alone. You feel absolutely vulnerable. You start thinking, what will happen if I wake up in the morning and there's nobody around? I get so scared, etc., etc. You start missing people. I think it's absolutely imperative then that each of you looks after everybody's neighbor. Not necessarily go and meet them, because that might not be a good idea. But call them up and just say, I'm there. If you need me, I'm there. And we worked out a rotation for some of our youngsters, non-bars, but in other communities. And they would actually call people and talk to them regularly. And somehow that seemed to help. I can think of nothing worse than being all alone. Even in psychiatric practice, we have some psychiatric conditions where amongst the symptoms that you might have, you have this feeling that everybody is against you, everybody is after you, nobody likes you, everybody is doing things because they can't stand you, blah, blah. And imagine living a life like that. Imagine waking up in the morning and saying, he doesn't like me, she doesn't like me. It's terrible. In a sense, at that time, you become very alone. Similarly, unfortunately, when you're old, when you don't have too many people around you, you start feeling very alone. I think it's incumbent on us as professionals and as people who are generally a lovely group of people that we kind of merge, that we kind of connect with the people who are staying alone and make them feel that it doesn't matter, we are there. That is what is going to make the difference. It's also imperative for all of us to do sensible things and look after our physical health. Doctors, I think we've lost something like in the last year, 600, or was it 6,000? No, I think it was about 800 doctors during the pandemic, which is a huge number. It's the largest. I think the second largest group of people who lost their lives actually were the cops. They were also out into the public trying to do things. They got infected and they also lost their lives. There is nothing as irritating to us as when we walk out and we see people who wear their masks where they shouldn't be wearing their masks, who don't sanitize properly. I mean, I go to my clinics and I have a person sitting opposite me and he suddenly pulls his mask out and said, I can't breathe. Let me put my mask on. And I said, sorry, you can't, push it up. But I can't breathe. And I say, go out, breathe and come back. But if you're sitting in front of me, put that damn mask on. It's not asking for too much. And if it is making you uncomfortable, too bad. Better that you feel uncomfortable rather than I feel uncomfortable. Better that you find it difficult to breathe rather than I die because you might be COVID positive. So let's just be very, very clear about that. We as a community have to bring to everybody's forefront the fact that you have to have appropriate COVID behavior or COVID appropriate behavior. I know how angry my wife was when she called for a rickshaw and the rickshawala had his mask down and she said, just put your mask up, and the guy drove away. I mean, ridiculous. I don't know what we are coming to. What are we trying to prove? That it's not going to happen to us? Nonsense. It happens to everybody. And that's another thing that I'm now going to say. Unfortunately, in the second pandemic, we've reached a stage where just about all of us know somebody or the other who's dead, or somebody or the other who's got COVID, or somebody or the other whose family is affected, or somebody or the other. It's just somebody or the other. We are lucky if it doesn't happen in our own families. We are not pieces of wood or pieces of stone. It's going to affect us. How do we cope? Now, some people say meditate. Some people say do yoga. Of course, those things are useful. Some people say stay connected, talk about your feelings. And I say that's extremely important. But if you reach the stage where you start not being able to sleep, you get very, very negative about things. There's a constant flurry of thoughts in your head, which doesn't really reach a conclusion. If you start thinking of suicide, if you start getting very negativistic, if you're lying in bed the whole day, or if you get very detached, very unsociable, have no satisfaction in anything, if we are getting into a situation where this kind of thing happens, then you need professional help. And please, for God's sake, seek it. It is remarkable what professional. I'm not saying that we are God, but I am saying that we're going to be able to do a lot that maybe you would not be able to do unless you took the medication. I'm not again saying that everybody needs medication, don't get me wrong. But I am saying that if you've reached a stage where what is happening to your mind is hindering the way you're reacting to people, hindering the way that you're interacting with people, hindering your normal day-to-day activities, then you need professional help. And you should ask for it. I mean, if you had a stomachache, I'd expect you to go to your GP or I'd expect you to go to a gastroenterologist and seek the help for it. If you're having a psychiatric illness or psychiatric symptoms, please seek the help of a psychiatrist. Let those bijao go to help. Now, the other thing that I need to talk about also is myths associated with psychiatry and myths associated with medication. Like I said, nobody's saying that you're going to be on medication for the rest of your life. However, what I am saying is this, that if you have a problem and you need the medication, then you're going to take the help of the medicines, which a qualified doctor is going to give you. And that qualified doctor, for God's sake, is not Dr. Google. Dr. Google is not a doctor. He's about 18 years old. Most of us have been doctors for much longer. There's nothing as irritating to me as when somebody comes up to me and he's had 20 minutes reading up of some stupid thing in Google, and he comes and he argues with me when I've had about 35, 40 years of dealing with patients. Please keep Dr. Google to one side. Please trust your doctor. The other thing, I can't take medicine because people say it's not good. Who are these people? I don't know, but people say it. But who are these people? I don't know, but people say it. Doesn't make sense. Get out of there. Start using your bhejas. We all have lovely bhejas. Parsis are supposed to be amongst the most bhejaful people in the world. Let's start using those bhejas and doing things that make a difference. And that includes looking after ourselves. Now, please don't get me wrong. Once again, I am reiterating over and over again, everybody who comes to me does not get medication. But if they do need medication and I give it to them, trust me, I know what I'm talking about. Question me, but don't argue with me. And for God's sake, don't come out with statements like, you know, when I was in college 40 years ago, I studied psychology, so I know everything. Yeah. When I was in school in the 8th standard, I learned anatomy. I learned the bones in the body, so I can deal with a fracture. I can't. Leave it to the professionals. We know what we are doing. We are not nincompoops. We are not nitwits. Having said that, I think our community is lovely. I think they're very open. I have a huge Parsi community coming to me. And look, I'm not racist. I'm not for or against a community, but it always makes me feel very good from inside that we are such a lovely community and that we are not scared of asking for help. And please keep asking for help. People ask me, how do you be happy? It's tough. One of the things that we used to talk about in the past was everything that happens to you right now is related to the fact that you had an absent mother or a very cold mother or an absent father, or that you weren't breastfed enough in life, or stuff like that. All of that now has changed. Today we talk of genetics. There's an explosion of genetics that has happened. So we will almost be able to identify that if you have this problem, it's very likely that somebody in your family had this or something allied, and so on and so forth. Today, if I do a PET scan or an fMRI or some CT scans, I can actually see parts in the brain which are different from those who don't have a particular problem. So I might be able to even prophesy in advance that you might actually land up having this kind of an issue. Everybody talks of chemical locha. That's one of the good things that Sanjay did. But chemical locha and the chemical transmitters is just 1/5 or 1/10 of everything else that's happening. Today, we talk of electronic circuits in the brain. We talk of synaptic connections. We talk of a whole bunch of things which actually talk of the brain and not of the mind. So if you have a problem, which is a psychiatric illness, it's related to the brain. I will give you stuff, or the therapist will do something which will get the connections going again, which will get the transmitters going again, which hopefully will bring the circuits back to normal. And that becomes so much easier then, and the person starts doing things which make a difference to his or her own psychiatric, psychological life. We owe it to ourselves to do the best that we can for ourselves. We owe it also to the family to do the best that we can for ourselves and for our family. We cannot go through life just, not actualizing our potential. I think we are a fantastic community and we are a fantastic people of Indians, give or take a few politicians here and there. We are fantastic. What we need to do is to work on that so that we land up actualizing our potential. So then India lands up being the superpower that is possible, that it can be. Not by whatever else is happening, but by looking after the mental health of its people in addition to the physical health. I think that is absolutely essential. I think that is absolutely something that we should look out for. And I think that is absolutely in our hands. What else can I do to be positive? Do the normal stuff that we say, lifestyle changes, etc., etc. Try to get as much sleep as you can. Normally not more than 7 to 8 hours a day. If you're sleeping 10 hours or 15 hours a day and you're not on medication, then maybe that needs to be looked at. If you're sleeping very little, that also needs to be looked at. Our youngsters and sometimes our oldies stay awake till very long. And then they say they compensate by sleeping 2 and 3 hours in the afternoon. It doesn't compensate. Melatonin, which is now the wonder drug that we are using, which is also a naturally occurring product which is released in the brain. Actually, the replenishment takes part in the darkness of the night. So if you're not sleeping enough, it's not going to be replenished properly. It's going to have a whole bunch of problems. All of us occasionally stay up late. It should not become a habit. You should not be sleeping at 3 and 4 every morning because you love Netflix. Stop the Netflix or watch it during the day. get proper sleep at night. We need some amount of physical activity. Now, physical activity of any kind, walk, run, cycle, swim, play a game, it doesn't matter. Please be COVID careful with whatever you're doing. Don't act foolhardy. Right now, for example, if you feel that your gym is, I mean, gyms are closed right now, but if they were not sanitized properly, or you were not sure whether they were not sanitized properly, don't go to the gym to become stronger and then come back with COVID. So things like that. 45 minutes, 4 to 5 times a week is supposed to be a very good thing if you can manage that. And especially for Parsi ladies, and there'll be a lot of new people on it, we have a lot of osteoporosis. Seems to be almost in every Parsi lady. So osteoporosis is something that is benefited by exercise. So please, please, please exercise. The other way where it's supposed to help is cancer breast. And unfortunately, a lot of Parsi ladies also have cancer breast. And to some extent, there are some papers which say that the incidence of cancer breast seems to be pushed a little later and maybe not even happen, provided you do a little bit of physical activity. So that seems to help. So please do physical activity on a daily basis. Drink once in a while, don't drink every day. However much we love our khawanu and our pivanu, let's eat in moderation, let's overdo it. Certainly don't smoke. For God's sake, don't take drugs. Even if things have been legalized abroad, it doesn't mean that it's okay. And I'm certainly not saying that alcohol is not also an addiction. It could be, but the stuff that we see happening with drugs is much, much more than the stuff that we see happening with alcohol. So get into a situation where you do the best that you can, live a good, normal life. And finally, if you're spiritual, if you have faith in an upper being, in a being who's there, who somehow is maybe trying to see how we all cope with whatever is happening, then have the faith and the trust that this will move. Have the faith and the trust that we will survive, because we always have in the past, and hopefully we will survive this horrible state of affairs that we are in as well. The bottom line is, let's be as positive as we can. Let's help each other as we can. Let's nurture each other's. Let's be as connected as much as we positively can. Let's look at the positives rather than the negatives. And one very important thing, which I keep telling everybody, reduce the amount of time you spend on the horrible visuals on television. It shouldn't really make a difference to you, in a sense, whether 10 people are affected or 100 people are affected or 1,000 people are affected. You can't do anything about it. So, stressing yourself while seeing those horrible visuals on television, I see it once maybe, but I have clients who are like glued on television, and they're watching it 4 and 5 and 6 and 8 hours a day. And I don't think that's a good idea. It's just going to aggravate your own anxiety, and it's not going to help any. So let's get into a situation where we learn about what is happening in our country and what is happening outside our country. Of course, we shouldn't be ignorant, but let's not get obsessive about news. And let's hope and pray and have the faith that we will overcome, because I have no doubt that we will. I've been asked to stop after about 40 minutes and then leave it open for questions. Pearl, over to you.
Yes, thank you so much, Doctor. It was really amazing, very informative session. And we'll start with a few questions right away. The first question we had was, don't you think that the absence of joint family system, even unmarried children not wanting to live with the parents, has made the situation worse? With work from home, the children cannot manage work, parents, and the housework. Any advice you can give for that?
Okay. Now, I'm not going to get into too much of this, but if you're looking at joint families, they have their advantages, they have their disadvantages. Every joint family is not paradise. Every single family is not paradise. So we talk with individual situations. Please, I'm not going to generalize. Yes, especially at times like this, if you're all living together and if you can support each other, it's wonderful. But if you're all living together and you're at each other's throats, it is not wonderful. So let's not live in a utopian, hopeful feeling that all will be well if everybody is together and all of that. Given all of that, there's no question about the fact that if you're not feeling well, if you maybe have COVID, or if somebody in the family has COVID, and there's a bunch of people around who you can kind of depend on, and that bunch of people happens to be family, there's nothing that can possibly be more supportive than that. So yes, it has its advantages, but it also has its disadvantages.
Thank you, doctor. Next question was, any solution or help with insomnia or lack of sleep?
Now, insomnia is one of the most common symptoms that we are faced with when people come in, and they could be for a huge bunch of reasons. So you can be insomniac because of your thoughts. You can be insomniac because there's something which happens during REM sleep, which is rapid eye movement sleep, where you actually have the dreams. You could be insomniacal because of physical conditions. You need a proper evaluation. There's even something called a sleep study. You might not sleep well because you have something called obstructive sleep apnea. There are a whole bunch of other things that that can cause the sleep issue. One of the things that is known to help to some extent, of course, is what all of us probably do, which is we try to tire ourselves out. But sometimes getting too tired also keeps you awake. So it's nothing very easy. It's nothing very simple. You need a proper evaluation. Please don't get into just taking pills. Sometimes you have other issues related to the pills that you take, or that your mom takes, or your grandmother takes, which your family doctor had given you. Those are avoidable. It would be a good idea to get a proper evaluation done by somebody like me, or somebody somebody else in the family, somebody else in the fraternity, rather than just, mommy was taking it, so let me also take it, which a lot of us land up doing. And then you also have things which are related to psychiatric conditions. So for example, if you have OCD and you have a plethora of thoughts which are coming into your brain all the time, and at night they continue and you just can't get sleep. So then sometimes things are done to reduce those plethora of thoughts. And when those plethora of thoughts come under control, you get sleep. So you're not dealing with the sleep, you're dealing with the psychiatric condition. All proper evaluation, absolutely essential. One cannot generalize.
Great, doctor. Coming to the next question about medication. As you said, people are quite
very frightened. Okay, let me talk about it.
They are about the side effects.
Yes. There are myths related to psychiatric medication. First of all, let's start off with the premise that everybody doesn't get psychiatric medication, but if you need it, you need it. This whole thing of it's going to cause me to sleep all the time, it's going to make me put on weight, it's going to make me keep me awake, it's going to get me under your power, I'm going to become a zombie. All of that is absolute, unadulterated balderdash. So when we give medication, we give it related to a particular condition. If you're, for example, depressed and you're not sleeping, I might give you something which would reduce your depression and as a side effect, enable you to sleep. If you're depressed and you're sleeping too much, I will give you something which reduces your depression and as a side effect makes you sleep less. So we are not nitwits. We're not doing things which make it worse. I'm certainly not saying that medicines are the panacea for everything, but I am also certainly saying that because of your own fears about what you have read or what others say, and we don't know about others. One of the things that we need to do is be aware of the fact that if the doctor is suggesting things, certainly ask your doctor about side effects, but let's become insane and don't read Dr. Google. In Dr. Google, all of us take up crocin. Try reading up side effects of crocin, you'll never take it in your life because either you die or you get cancer, which is stupid. 1 in a million people gets a side effect, it is mentioned. Are you going to be that 1 in a million? Then we'll never take anything. We live on air and now we don't even have air properly to have. So that's going to become a problem. So please follow the doctor's advice. Now, another question asked, how long do we have to take it? First episode medication for most illnesses, which are long-term, would be for 9 months to a year at least. If you get well, and that is after stability. So you might feel actually absolutely fine after a month or two, and then you try to stop the medication, chances of a relapse go up to 70 to 80%. You take it under supervision from your doctor, not from anybody else. You take it under supervision for a period of 9 months to a year, then he starts tapering it off, chances of a relapse come down to 30 to 40%. So it's better to take a medicine for a longer time period. Some of you will need medicines for a longer time period. And I'm often asked this. So I say, supposing you're diabetic, you're going to take medicines for the rest of your life. And if your medicines are controlled, are you going to tell the doctor, my sugar is controlled, nobody's going to do that. If you are hypertensive and you're taking 2 or 3 medicines for that, your Pressure comes under control. Do you go to your doctor and say, can I stop it now? My pressure is under control? No. But if you're depressed or you're anxious or you have OCD, somehow everything is under control. Doctor, can I stop it? No, you can't. Follow your doctor's advice. But it's going to affect my brain. Well, guess what? Most anti-diabetics, most antihypertensives, the thyroid supplement that about 30 to 40% of the population takes in the morning before breakfast, all of them work through the brain as well. But nobody's worried about that. So why are you worried about our medicines? We're not ogres. We know what we're doing. If there are side effects, we deal with it. None of us are nitwits. None of us are going to make you feel worse than what you're feeling. If there's a side effect, we'll deal with it. If there's a problem, we'll deal with it. But it is stupid and ridiculous on your part not to take medications when they indicate it. The other thing, especially for kids, for example, and we don't have too many kids, but I just heard that we got 370 kids through or 360 kids born through Geopathy. Congratulations. Some of you are going to end up being hyperactive. I mean, that's part of the course, 12 to 15% of the population. I've had so many kids who have hyperactivity with attention deficit disorders, proper evaluation done over a period of time, go through a whole bunch of things, etc., etc. And then you come to a conclusion that you have to take medication. Parents are scared of medication. There are certain medicines which reduce hyperactivity. Now, do realize if a kid is hyperactive, not paying attention, very restless, etc., he's going to be a pain to be with. He's going to land up losing his friends. His friends are not going to want to be his friends. So then what was originally a neuro problem lands up also becoming a social one. And then you land up becoming an emotional one because nobody likes to be friendly without friends. Give the medication under supervision, and when things very often change so drastically that I've had parents coming up to me and saying, Doc, we waited and waited and waited for about 9 months to a year before we started your medication. And I know you were irritated with us. How I wish we had done it before. Once again, I'm not saying medicines do everything. I'm not saying they're wonders, but I am saying that you need to try out. If a qualified, sensible, experienced doctor suggests it, don't just take it that your 10 minutes of Dr. Google reading and your kaka, mama, chacha, papa, who has his own 1800s theories of medication and how they should not do and what will people say, that should not come in the way of actualizing your potential.
Thank you, doctor. One more question related to medication is when the patient is depressed or suicidal, many times patient refuses to take medication and the spouse or the caregiver may be busy or working all the time. So how do we ensure? They sometimes just throw it or flush it. For that, what is the advice? Is hospitalization
so the advice
needed?
Yeah. So I'm glad you asked me this, and I'm so glad you asked about the hospitalization. One of the things that you can do is that even if the person is out, if the guy is taking the medication or the lady is taking the medication, adjust the timing so that it is done before the other person goes to work, and put it in your mouth and give the medicine, and very often that works. But related to hospitalization, at one time doctors were allowed a whole bunch of things. Today it's not allowed. It's supposed to be illegal. So the government, in its wisdom, is attempting to safeguard the rights of the patient. So if a patient refuses it, then you can't do much. What can you do then? Against the person's will, if necessary, he can be taken to a hospital or a clinic or a nursing home, which has registered under the Mental Health Act, which came out about 2 or 3 years ago. And according to that, you are kept you have to sign a particular paper, then you're evaluated in the next 72 hours. And in the 72 hours after the evaluation, if the attending doctor feels that the person has a problem, then the person can be treated even against his will. If, on the other hand, it is taken that you wanted to get the person admitted because you were eyeing his property, then, and the doctor finds that, there was no evidence of any psychiatric illness, then you can be prosecuted. So they look after the rights of the patients too. But certainly, if there is an issue, and especially if you're talking of suicide, get the person to take medication. You don't have a chance.
Okay, thank you, doctor. The next question, role of positive self-talk, centering or meditation. Does it really work? Does positive.
Okay, so it helps to some extent for the very mild cases. I'm sure if I keep telling myself I'm a good chap, I'll start feeling good about it. It's not going to work for the very serious ones. It's like saying that, I like physiotherapists. I think they do a fantastic job. But if I fractured my leg and I went to the doctor and he said physiotherapy kar, then I think you're a bit of a nut. So also, if there is a major psychiatric illness, then to talk of meditation and yoga and self-centering and all that is nonsense. Given all of that, if it is not a very major illness and the psychologist feels that he or she can benefit the person by doing psychiatric, by doing psychologically based therapies, which include mindfulness and whatever else has been said, a lot of them do a fantastic job. So certainly they do have a role in our armamentarium of what can be done.
Yeah, thank you, Doctor. The next question is the 10th standard students, their exams have been cancelled and there are others who are now going to the 10th grade.
Yeah.
Any advice? Because there's a lot of anxiety, stress that the parents also and the students have been facing. It's very unsafe.
Yeah, I know. Yesterday I was part of a panel discussion, and that panel discussion related actually to this. It was organized by the Yuv Sena, the youth of the Sena, Shiv Sena, and we had something like 5,000 people holding on, and it was only related to 10th and 12th standard kids. It's a horrible situation we are in. But all I can say is, once again, everybody's in the same situation. So it's not that only one school is affected or one board is affected. We're looking also at it in terms of situation that it's better probably not to appear for an exam and work out another modality of going to another school rather than go for an exam and then land up having a physical illness, or land up not only having a physical illness in yourself, but spreading it to others. What do we do about it? We hope and pray that a solution is found. I have no doubt that the education ministry will not get up one day saying, what can we do to make things work or to make things horrible for our kids? They're not going to do that. They're going to get input from everybody, including stakeholders, including the government, including physicians, hopefully including psychologists and psychiatrists. And we'll come to some conclusion as to what can be done to help the kids through this. It is a bad situation. Nobody's saying that you should kick your legs up and dance with joy. But we are saying that since everybody is in the same situation, let's just survive it.
Doctor. The next question, how to cope with fear, helplessness, negativity, as well as the economic crisis that so many of us are facing?
Now, fear, hopelessness, negativity, I've already spoken a little bit about, being positive as much as possible. But what we're looking at is the fact that there is reality in terms of an economic problem. I mean, I have had, in this pandemic, I must have done about 200 odd webinars, and some of them have been to industries, and they're industries which you would not normally think of as having problems. So for example, there was the real estate thing. Now, real estate was a big boomer. Now nobody's buying things. So they have problems. I know I've had a patient who was a pilot and his wife was an air hostess, both doing brilliantly. And you're thinking in terms of the future. So you book a house and you're paying off huge EMIs, but you never bothered about it because you were earning so much. And suddenly all that earning stops. And what on earth do you do? It's a tough situation. So what do? We try to accept that you try to learn some new skill if it's possible. Sometimes it's not. You try to do the best that you can. You certainly reduce the unnecessary expenses. There's no two ways about that. Sometimes I'm aghast when I see, a patient came up to me and said, I'm not doing very well and there's an economic status, or he spoke to me on the phone, but I'll come back to you after about 2 weeks because right now I'm going to the Maldives. And I'm like, great, that sounds nice. So, things like that don't really make sense. If you find that whatever is happening around you or within your economic status is affecting you to the extent that you're getting very depressed, very anxious, suicidal, because that is also happening, unfortunately, please seek psychiatric or psychological help. And I have no doubt then that the help that you get will enable you to cope better with whatever you're going through.
Thank you, Doctor.
Also ask for help. Sometimes we don't ask for help. What will people say? What if he says no? Sometimes our anticipatory stuff is nonsense. I think most of us are nice. If somebody came up to me and asked me for help, it's very unlikely I'd say no, unless I couldn't cope with it. I think most people are like that. But I'm not going to be able to look into your mind and say, oh, you need me to ask, you want help, but you're not asking me, so let me provide it anyway. That's not going to happen. So ask people if you need help, and it will be provided.
Great. Coming to the next question in relation to what you just shared, Doctor, basically any kind of professional help, like going to a psychologist or a psychiatrist, sometimes is very expensive. I mean, per hour, the rates are pretty high, especially in metros like Mumbai. So any other places like municipal hospitals or something
Yes.
you would suggest?
Yes,
Where,
yes, yes.
yeah.
See, we all passed out. I mean, in our time, we were very lucky that we all did our training in either government or municipal hospitals. At that our time, we had no private hospitals. So we learned a lot, and our current bunch of municipal and private hospital and government and private hospitals also, they do have extremely reasonable rates of treatment and things like that. Most private hospitals will also have a free OPD for the consultants. So even though you might have to pay X amount for the regular rate, there would also be a kind of free OPD where there'll be a very nominal charge. There are a lot of helplines which are also available. Even our psychiatric societies have it. So if you get on to the Psychiatric Society app, you'll find some helplines. You can call them up, etc., etc. You will find something. You will.
Thank you, Doctor. The next question is one of our viewers' neighbors lost her husband to leukemia, and caring for the spouse really left her quite depressed. And now she's so afraid of illnesses that she's completely secluded herself and her two teenage daughters. Our viewer wanted to know whether she could help out her neighbor in any which way. They are on WhatsApp.
Sure, that's a horrible situation, and I'm so sorry, and I'm so pleased that you want to help. I think your being there, just talking to them regularly would benefit over a period of time if you can persuade them, especially the mother, to seek maybe professional help, because obviously she's in the part of what you would call a very severe grieving reaction, which she has not been able to cope with. And given the fact that the pandemic is the way it is, where people have shut themselves up because they're so frightened for the future, it's not surprising that everything has got aggravated. So if they can in some way take up the onus of pushing the mother towards seeking psychiatric help, I do believe that would make a difference. But kudos to your caring, and I wish everybody did that.
Thank you, Doctor. Under the given circumstances, can you suggest ways to strike a balance between parents and children at home? How to keep them gainfully occupied and away from, there's overindulgence in electronics too.
Yeah, okay. So now one is the electronic thing. So let's talk of the electronic thing. If the kids are going to school and they're doing online studying, then as a rule of thumb, it should be that for your relaxation, try to avoid that, try to do something more physical or more interactive. When we were going to school 7-8 hours a day, then you come back home and then you spend some time electronically. That's okay. In a sense, that's okay. It's not okay if you're already doing 8 hours on school, and then you're doing online tuitions or classes, and then again for relaxation you get online, then that's going to cause a problem. Having said that, there have been studies done, and they found that for example, the pediatric societies, they did some studies and they found that it didn't really affect the eyes, because we were very worried about that. Yeah. Provided the place is lit up properly, that you're not doing it in darkness, there doesn't seem to be too much of a strain. They've found out, of course, that we do need to interact more and more. People are talking of addictions, which may be overrated, but hopefully they are overrated. Try to lay down the rule and have a kind of a balance between electronics and other stuff. Be more interactive, play board games, play cards, do physical activity, do gardening, etc., etc. The first part of your question was something that I am passionate about. I do believe that everybody in the house should take up some chores. Sometimes what happens is that we'll end up having only mom or dad do everything, because the kids, how do we expect them to do? Yes, you should expect them to do. So I've even got 4-year-old children to be in charge of, say, putting mats on the table. You need to give them that sense of responsibility, so that they also feel that they're part of the whole corundum of whatever is happening, so that they also feel that they are doing something useful. And that goes for the older person in the family as well. Give them peace to shine. Maybe let's take 1 hour when you would have taken 20 minutes. It doesn't matter. Let them do that 1 hour of peace shelling. Let them feel that they are doing something that makes them feel useful. Otherwise, not surprisingly, they will then land up feeling that they are a burden. And it's terrible to see old people come to me and say, Doc, mane kaya apo jara mari jao, I'm dependent on everybody. My parents, my kids are very nice. But ये लोग को बदू काम करे. मने हमारे पास तो कहीं भी नहीं है. वो शू करूँ doc. That kind of thing shouldn't happen. Really shouldn't happen. We're all going to get old. Powers don't die. So.
Very good advice, doctor. Thank you so much. Coming to the next question, mood swings. You very rightly said for medication, there are a lot of people try to avoid medication, but then their mood swings affect the entire family.
Yes.
But till that person is really not willing to go and seek help, how do the family members try and cope with the mood swings? Even children, elders, menopausal women, we've seen their mood swings affect the entire emotional well-being of the family. So any suggestion till medication can be started for them? How could the family support each other?
Okay, so the family supports each other is fine, but I think if you have mood swings and the mood swings are enough to be given a psychiatric diagnosis, then without medication, you're not going to get those mood swings under control. So, I mean, you can be supportive, you don't get angry, you don't get irritated because finally the guy is behaving in a particular way, not because he doesn't like your face, but because he has an illness. But at the same time, medication is a must. If there are mood swings which are severe enough to be called to warrant a psychiatric disorder. If it is not, then it's a different ballgame altogether. Then of course, you be supportive, you try counseling, you try a whole bunch of other things. And if that works, great. If it doesn't, then you still seek the help of a psychiatrist and see if there is a way between that is happening where it causes an issue and something can be done about it.
Thank you, doctor. Coming to the next question, what could be the red alert signs that the particular family member needs psychiatric consult?
Wonderful, wonderful. So I'm going to go through the whole spectrum of ages. When you're born, if the kid is not having proper milestones, if he's not walking enough, when I say he, it's also a she, obviously. If he or she is not walking properly at the right age, talking properly at the right age, not neck holding properly, finding it difficult to negotiate steps, etc., that should be a thing that there is something wrong. If the kid then over a period of time lands up becoming very hyperactive, restless, that could be an issue. If the kid has a major problem with speech and speech development, or lands up also having issues similar to not having proper eye contact, having an issue with doing the same thing over and over again, not seeming to care whether people are around or not liking to be touched, that is again something that we need to look at. If the kid is very aggressive or if the kid is too docile, both of them need to be looked at. If the kid doesn't eat well, doesn't sleep well, that again needs to be seen. Growing a little older, if the kid has a problem with spellings, if the kid has a problem with reading, if the kid has a problem with basic math, and you feel that the kid is intelligent enough but is still not doing that, then you need to rule out something called a learning disability. That is something that needs to be done. In addition to that, you look at the restlessness, you look at the hyperactivity, and that has to be evaluated. If you grow a little older and you find there's too much of aggression, or there's too much of quietness, too much of non-socialization, that again is something that needs to be evaluated. You grow a little older and then you come to a situation where you're having relationships. And if sometimes there's too much of excitement, too much of depression, too many mood swings, too much of talk of it has to be my way or no other way, too much of substance abuse, and not even too much. If there is substance abuse, that is something that certainly warrants an evaluation. You grow a little older. At the age of about 25, 30, you look back and you say, I haven't done as well as I should have, and there's depression and anxiety and OCDs and the other psychiatric illnesses. That is something that you need to look at. At the age of about 50, 55, you're coming to the end of your, by about 60, you come to the end of your work profile by and large. And that is the time when again you look back and you sometimes feel good about what is happening. You start getting what is called the empty nest syndrome, where people are leaving you, your kids are leaving you, and maybe you're no longer in a very important position in the work you are doing, and people start bypassing you. you'll end up having issues, you feel depressed, sad, cry, become very angry. Those are things that need to be looked at. As you grow older, you have the degenerative issues. So you get Parkinson's and you get the movement disorders and you start forgetting things. And we have a lot of that happening now, the dementias and the other and the Alzheimer's. That is again something that needs to be looked at. And the usual stuff of anger, sadness, depression, not being able to sleep, biological issues like even severe constipation, palpitation, all of those can technically be also related to a psychiatric issue. For kids, sometimes the only symptom is depression is actually pains and aches. So I have a headache and a stomachache and this, that, and the other, and I go and I get all the investigations done, and there's nothing wrong with the kid. And then the doctor will say, go see a doctor who deals with the brain. And it's because of somatization, which occurs because you're very stressed. For the older person, again, not being able to sleep, severe stomach aches, very often associated with the psychiatric illness. In fact, half the gastroenterologists will give you my group of medicines and you won't even know, because they know that it makes a difference to the way your gut behaves. So things like that.
Excellent.
In other words, whether you're young or you're old, please come and meet me.
Excellent advice, Doctor. Thank you. The next question has been asked is community. We are a community of elders, and many of us may not need financial support, but basically the emotional and the community support. Is there any structured way that can happen where the elder who are lonely could connect with the young ones so that this loneliness and depression could be abated?
Well, I think actually people from your foundation should be in a better position to answer that. I would certainly say it makes a difference. And I know that I work a lot with churches, not the Catholic community. And in the churches, they have these little, committees where people are interacting all the time. So you have kids interacting and doing things. You have adults interacting and doing things. You have communities where they look after the needy. And there's constant interaction. I think you people should be on the forefront for that as well. So considering you've done such fantastic work, you'll probably be in a better position to answer. If you're asking me whether it would make a difference psychologically, yes, it certainly would.
Great. Thank you, Doctor. We'll surely look into that. And also during the last pandemic and currently also, BPP also has a helpline, the Bombay Parsi Panchayat. So we have quite a few volunteers who are actively working on that too.
Wonderful.
Yeah, we are almost at the end of the session, but we have so many questions pouring in. We would just like to request 10 more minutes of your time, Doctor. Would
absolutely,
that be okay?
Absolutely.
Great.
By the way, I saw something. My number has been put on your thing. Please feel free, but please WhatsApp me. If you call me, I probably will not answer you. I get about 1,000 calls a day. It's impossible to keep up with it. If you WhatsApp me, I promise you that at least by the end of the day, I will get back to you. It may not be immediate. A lot of my patients, a lot of my friends are also on this. So they know that I, by and large, at least, unless I'm in a very, very grumpy mood, I would answer you within 24 hours. So please feel free to WhatsApp me. It will be a pleasure. And in that, if you write from Geo Parsi, that will be nice.
Thank you so much, Doctor. That's very kind of you. Coming to the next question, how will children cope when schools reopen in the future? We don't know.
I know.
And
That's
how can we help them now so that they could cope better?
Yes, this is something that I've been asked often, and frankly, I don't know, because I don't know, first of all, when the schools are going to reopen. I don't know which standards are going to reopen, and I don't know in which form they're going to reopen. You might have half the kids coming in the morning and half the same class coming in the evening, provided the school has the infrastructure. Very often schools don't. So that becomes a problem. But the bottom line is we have to just cope with whatever happens. Just like we coped with whatever is happening now, we have to cope with that. Taking into account the fact that kids will have problems. I mean, I was just thinking, you have a kid who's maybe in nursery and he's going into junior KG. He's not gone into junior KG. It's like he's just still in nursery. You have a kid who was maybe in play school and was supposed to go into, a regular school. He hasn't gone into a regular school. He has no idea of what it is like to be part of a huge institution, to have different teachers come in. You have kids who have been moving from primary to secondary and suddenly it's not there. You have kids who are in the 10th and haven't been able to appear for exams, and there's a big big thing happening for them. I've had people whose daughters had finished with their graduation, for example, and for their post-grad had got scholarships to go to the most prestigious universities abroad, fantastic scholarships, and they couldn't go because everything just stopped. And their dad said, "No way are you going? I don't care. Don't get that post-grad degree. I'm not sending you there." So it's a new world we're living in. We have to be as positive as possible. We have to be as supportive as possible, and we have to be as sensible as possible. Supportive and friendly and all of that does not mean that because young blood says I must do it, that you just give in to it if it is foolhardy and dangerous. There we would hope and expect that the bheja of the older person is a little more sensible than the youth's impetuosity, and that he can say no without feeling that it's the end of the world.
Thank you, Doctor. Next question is, when people claim that children are already losing social skills, on what basis are they making such a serious claim? Any evidence? Because of internet and all, they're always online. When it comes to physical interaction, they do seem to be losing.
Yeah. So to some extent that might be true, because I mean, one of the things that we obviously know that if you're online and you don't like something, you can switch it off. If you're interacting with somebody on a face-to-face and you don't like what the person is saying, either you get away from the situation or you stand there and you face up to whatever is happening. So that is the difference. To some extent, you'll have to relearn more of face-to-face stuff. But I would tell you that most people still prefer face-to-face stuff. I mean, so often I've asked patients, would you like a video call? Would you like a video call or a face-to-face consult? And they say, no, we want to see you face-to-face. So people still have that connect, and I think that's never going to change.
Thank you, Doctor. What are the 3 must-dos in this time to keep our mind positive? 3 in short things all of us could follow to just stay positive during this time.
I think high up for what I would say is don't watch the news as much as you normally do, because I think that is probably the biggest cause of the unhappiness that a lot of people are seeing. Point number 2, be aware of the fact that it's happening to everybody, that you're not being singled out. So it's not that, people are biased against you and it's only happening to you, it's happening to a huge number of people. That doesn't really make it better, but at least it makes you feel that you're not being singled out. Point number 3, look for the positives and stay as connected as you can be, and take it that if we've survived through holocausts and so many other things, we've survived pandemics in the past, we should be able to survive this as well. So let's just look for the positives rather than keep cribbing about the negatives.
Thank you.
That's 3. Yeah.
Thank you so much, Doctor. From Geopathy side, also I would like to share that we have helpline numbers that we've put up in Jame Pasi Times, and we also put it up on our website. We've throughout the pandemic been counseling people, and I think just talking over the phone also does help people stay positive. We've been working on that too, just for the viewers' information. Last question coming to you, Doctor, is please share how you are dealing with the current situation. Any particular yoga techniques, meditation techniques that you personally follow, or any other techniques, just because you are surrounded with so much of negativity. How do you go?
I must confess that I've never been as affected as I have been during the second wave. I mean, I find myself choking up so often when I'm dealing with horrible cases. We pride ourselves on clinical detachment, but it doesn't work. How do I cope? I cope because I have, I used to be much more physically active. I used to go to the gym regularly. Now that has stopped since 2 years. I try to do a little bit at home. That used to be a great way of reducing my stress, especially when you're angry with somebody and you're lifting weights, and while you lift the weights, you're giving good old authentic Parsi galis to that person. That helps. You can't do that now. So we do a little bit of physical activity. I have a wonderful family that has always been supportive, always been there. And I cannot even imagine how life would have been like if the family wasn't there. I have a terrific group of friends, and we talk nonsense, which is part of the fun. We share each other. I mean, they're just there if there's a need, if there's a problem, they just come down to the house and say, what's up? And it's almost like an understood thing. I have a huge bunch of fellow counselors, psychiatrists, some of whom are also, communicating on the chat, and they're so sweet. Thank you all for being there. They're just there all the time, talking about things. And one of the things that I have learned, and I would suggest to everybody, is that if you like something, or you like somebody, or you're thinking of somebody, send the person a message. Sometimes we don't do that, and it makes all the difference in the world. There's so often times it's a birthday. Now, normally we just send an indifferent happy birthday thing. Call up the guy and say happy birthday. We've lost that touch sometimes. And I think it is absolutely essential for us to keep the touch going. And given the fact that Babas are known ki tame khao ne piyo ne maja karo, let's just get into khawano, not so much pivano ne maja karwano. Let's do that.
Yes, thank you, Doctor. That's one of our viewers also saying the same thing, that one-way communication among messages makes us detached. Nothing to beat face-to-face communication, and phone calls or video calls are the best. Thank you so much, Doctor. Your invaluable time you've given to Geoparcy and the all our viewers are really indebted for that. Thank you, viewers, for logging in. It was really amazing to have so many of you connect on a Sunday morning. Stay safe, stay at home, stay sane. And to, to contact Dr. Kersi Chavda, please WhatsApp your questions. I'll repeat his number, 98210-310-70. As he said, he won't be picking up calls, but he will surely get back to you. For more information about Geoparcy, about all the benefits that we are giving and all the new upcoming events, please visit our website, geoparcy.org. And our Facebook and Instagram pages are always giving you new information, sharing some good news about all the births too. 300 plus babies have been added, and praying that this pandemic ends soon and our community numbers start increasing once again. Thank you, everyone. God bless.
Thank
you, Doctor.
Bye.
Bye-bye.
Thank you, Doctor.
Pleasure. Absolute pleasure. Bye.
Great session. Lots of positive comments.
Thank you.
Feedback.
Bye-bye. See you.
Bye-bye. God bless.
Thank you all.
Thanks,
See you
Chavda.
again soon. Please stand by for any future news on any of our Sunday specials. Thank you. Bye-bye. Have a nice, safe day.